Good morning. First of all, let me thank the organizer to invite me here. And particularly I want to thank Koki Agarwal and Jeffrey Smith for organizing this wonderful, wonderful gathering, bringing so many people from so many countries. Now, I'm going to discuss or talk about the maternal mortality reduction. You all from this region, from Asia, should be very proud because we are making progress, tremendous progress. We are, in many countries in Southeast Asia and also other Asian countries, we are going to achieve the Millennium Development Goal. So all of us should be very proud of. However, if you look at the global picture, still a little bit far away. We are still far away from achieving the MDG goal, the global picture. If you look at the number of deaths, Africa contributes more than half of the maternal deaths. The number of maternal deaths in Southeast Asia has gone down tremendously. Still, the number of deaths is because the sheer number of deliveries. Can you believe 27 million births every year in India? How many countries India is giving birth to every year, right? The sheer number of deaths is because of in India and Southeast Asia. However, in India, the progress is also tremendous. Indian government commitment for bringing down the maternal mortality is phenomenal. If you look at the maternal mortality in the regions, as I said, in Africa, most of the maternal death reduction is 27%, but still, the annual reduction is not that much, it's 1.7%. They need to do a lot. But if you look at Southeast Asia, the reduction is 5%, which is really needed for reducing maternal mortality and to achieve the Millennium Development Goal. Similarly, Western Pacific countries, also the maternal mortality reduction is 5%, and most of these countries will achieve Millennium Development Goal. If you look at the maternal mortality in Cambodia, the program in Cambodia, I want to thank the Cambodian people here. They are making tremendous job, and they are really, the work they are doing and the maternal mortality reduction is really, really, really good. And however, I cannot see my slides, I hope. Even with my specs, I thought I cannot see. But if you look at the Laos is doing well, but still the maternal mortality was very high, and the reduction and the progress is a little bit slow. But of course, in other countries in Southeast Asia, like China, like Vietnam, like Philippines, they're doing a really good job. Similarly, if you look at in Southeast Asia, Bangladesh, Bhutan, Nepal, India, Indonesia, everywhere, maternal mortality is coming down. But we should not be complacent. We have to work more, harder. What we need to look at, what next we need to do to make sure that we achieve Millennium Development Goal. But if you look at the vulnerable group, like the people who has got the age, too many children, too late children, if you look at that way, Egypt and Philippines are doing well. Most of the people of that age group people are having access to services. But in Bangladesh or in Pakistan, if you look at those particularly, the vulnerable group has got less access to services. Let's talk about Bangladesh because we are in Bangladesh, not because I'm the country I know best. I'm not supposed to tell you which country I come from, but the country I know best. Let's talk about that country. Bangladesh, the progress is really good. If you look at the reduction of maternal mortality is phenomenal. And we are pushing, and the government is committed to achieve Millennium Development Goal. And then you look at the 75% of the maternal deaths are happening on that age group. We need to look at, should we be doing something more? Or if you look at the maternal mortality ratio, age-specific maternal mortality of women above 40, very high. So should we be looking at that group first and not looking everything everywhere? And then if you look at the continuum of care in Bangladesh, most of the data are coming from DHS. Over the years, DHS survey. If you look at family planning, Bangladesh did well. Being a Muslim country, they did really very well. Antenatal care, 90%, at least once, women are coming for antenatal care. However, the deliveries by the skilled birth attendants or at the facilities are not that good. Cesarean section has gone up. But the postpartum care within 24 hours and beyond, it's really still not very good. We really need to look at. And I just looked at in many other slides, one slide to look at the quality of care in Bangladesh. If you look at antenatal care, 90% women are coming to the antenatal care services. Are they getting the services they deserve? Particularly even the rich and poor. Even if you look at the rich people, blood pressures are not taken. Danger cells not being told. Protein test was not done. So we need to really look at more concentrate, not the quantity, but look at the quality of services. And also look at different districts. Are the different districts are performing equally for service, access to services for skilled birth attendants? Khulna and Dhaka, they are doing well. The Borishal, Sylhet, we need to look at why, particularly those provinces are not doing that well. Even in the cesarean section, although it has gone up, but some districts, some provinces are not doing well. What about Cambodia? Cambodia has done well, but still there are some geographical inequities. We need to really look at not everything everywhere, but to look at all those districts who are lagging behind. Should we give extra effort to those districts to find out why they're not progressing and do something more on those districts? If you look at the service coverage and also cesarean section, Phnom Penh is doing well. Is it because all the politicians and the ministers are living in Phnom Penh, that's why? Or we need to look at the issues that what can be done in other districts or other provinces. Let's see when the woman died is during the first 24 hours. Most of the women and the newborn is a critical, for them is the critical period to look at what can be done within that period. Sometimes babies are well, sweets are distributed, and mother dying silently. We need to look at what we can do because the postpartum care is really becoming an issue which is not good in many countries. In Zimbabwe, when they found that most of the deaths are happening around the facilities, women are coming to the facilities, are dying there. We need to look at why. Are they coming late? Or the services at the facilities are not good enough, or quality is not good. Then we looked at in Africa, in many countries of 250,000 women, they answered the question why they did not come to the facility. If you look at it mostly either distance or transport or not money. It's all about money. It's all about purchasing power. It's all about access. So is that why Bangladesh, India has gone on demand-side financing? Maybe, I don't know. But we have to look at why women do not come to the facilities, what we can do to make them come to the facilities. Now, I will now take you through some photo stories. Most of the photos are taken by me, because for me, photo tells story, then I say something to you. And except the lamb, hospital's pictures, all of the pictures are mine, so responsibility is mine. Papua New Guinea. This is the labor room. Each woman has got their own cubicle. Look at the cleanliness of this labor room. We need to provide, like yesterday they were in the presentation in the opening speech, we need to respect provide the dignity. People are coming to the facilities. It doesn't matter what caste and economic status they're coming on. Every woman deserves the best. They should be respected. They should have the dignity when they're coming, giving birth to the facilities. This is Papua New Guinea. Now, Bangladesh, in many districts, sometimes when I go to the labor room, sometimes I felt like crying. I cried. Bangladesh has done tremendous work, have given the demand-side financing. Women are coming to the facilities. Many women never came to the facilities. They are coming to the facilities. But have Bangladesh invested more on the facility? Can the facility cope with the increased demand which is coming every day? Have we looked at the quality of care? So I have seen a labor room, small labor room, one door, no ventilation. The toilet is inside the labor room, and in the corner, delivery bed. Is that our women deserve? Is that the society can provide to our women? We need to ask that issue. I'll be a little bit critical, but critical not to criticize anyone, but to really look into the issues and make a difference. Sir, that's the only thing I have in front of me to see, right? People are on the floor. But this is one part of Bangladesh. And this is the operation theater. And I didn't take the picture. This is where they scrub. Next room on the left side is the operation theater. The doors are open. People are coming in, out. I saw the doctor sitting there in the chair reading newspaper. And I asked myself, God must be very, very happy with Bangladeshi people because we do not have infection. We must be doing something. God must be very happy with Bangladeshi people, all right? And sometimes you ask why it's so. But it's same Bangladesh, Lamb Hospital. How is it possible in the same Bangladesh? How is it possible labor room giving services, quality services? How is it possible that in the same Bangladesh facility deliveries are going up? People having confidence, people will come to the facilities. If you provide quality care, if you provide care with the dignity and respect and good outcome, people will come to the facilities. But then, Chogacha, again Bangladesh, how is it possible? Clean room, clean hospital, clean ward. How is it? But still, because so many people are coming to the Chogacha, 98% deliveries are happening in that district of all people coming to the facilities. But they do not have space. That's what I'm talking about. That should we now look at investing on facilities? People are lying, but still it's clean. Still it's there getting something. And look at the theater. Same Bangladesh. Same Bangladesh. Why it is possible? Look at the scrub room, Chogacha, just next to another hospital. How is it possible then? So it's not that it is not possible, it is possible. And they did not get extra money from anywhere. They have done it, what money they have. How is it possible they can do it? This is the labor room. And sometimes I ask a woman with a pain, lying down there for so many hours, cannot turn this way, they are thinking of falling, and they cannot come that way thinking of falling. Is that what we should be giving to our women? But at least there is something clean. I'm not saying that is not good. Again, India. You cannot believe what is happening in India. With the demand-side financing, women are coming to the facility. Many women I have discussed, they never thought of coming to the facilities. They are coming to the facility. But go to the facilities, they cannot cope with the extra load they're having. I will finish before 5 minutes. All ward and facilities are full. Look at the labor room. Look at the labor room. India, sending rockets. India, there is no problem of money. India doesn't have problem of money. Not at all. They have got good people. But how we are going to make sure that this get improved? These two ladies, when I met them and took the picture, few hours before they delivered, in that room. In that room. Why? And then I go to the next hospital because of the newborn awareness and everything. Look at that. Same hospital, labor room and newborn room. So it's possible. It's possible because it's not something rocket thing, that rocket science. If that they can do it for the newborn, why they cannot do it for deliveries? Now the question then we need to ask, is this only the demand side financing, or we should be looking at the supply side? If women are coming to the facilities and facilities are not ready to cope with, shouldn't you look at also the supply side of it? Why a midwife, when they're delivering 5 or 6 in a month, now they're delivering 70 or 100, what is their motivation to do? How the managers, we never talked about the management issue, or how they can manage the services. We never spend money on that. We talk about technology, we talk about different intervention, but never talk about the management issue. How the managers are going to motivate it, how they are going to really manage and reorganize the services. Do we need so many big facilities and every corner have got a midwife and they're delivering 1 or 2? Or they accumulate them in 1 facilities or 2 facilities or 3 facilities, improve the quality, right? And then improve coverage. Or should we be doing everything everywhere? Is it an organizational issue? Is it issue of organization? Is it issue of quality? And is it issue of monitoring? Are we really monitoring what we are doing? If we are not monitoring, we are not going to progress. Then I take you back to the audit, verbal audit they have done in Bangladesh. Look at this. I'm not going to read why that woman died. That woman shouldn't have died, isn't it? Is it rocket science to change this? If we ask ourselves, can't we make a difference? And then they recommended, look at that big no. That big no. Look at just this. They are recommending, make sure that facilities, quality services are provided. Right? So we did in Geneva, what we did a computer simulation with putting all those inputs. If we really improve the quality, facility, services and improve over the years, we can reduce huge number of deaths and mortality for children and the mothers. But to do that, we need partnership, not this type of partnership, equal partnership. Without partnership, it's not going to happen. And for me, women deserve the best. For me, society needs to give the respect and dignity the women deserve. We are not doing it. We need to give the best. But for that, I have a plea. No more poor option for poor people. Every woman deserves the best. And the poor countries are not rich enough to really invest on going on and on the pilot projects and all those small interventions, not looking at the big picture. Thank you very much.